Dr. Ricardo, we do have a bit more information on those mask mandates, and you and other people are asking people to wear high quality masks. What should people be doing to protect themselves right now in light of the fact that, again, we've got some changing between, changing regulations at the state level, as well as what other doctors are saying at this point?
Thank you, Chris. I believe that when I've been hearing about talking to people in our communities, people are getting a lot of confusion with the way we've been changing the public health information in the past 2 years. In reality, sometimes people will believe that we are confused, that what we're doing, that there's several conflict between the scientists. In reality, what we're doing is we're handling a pandemic that is moving at a fast pace in front of us. Confusion has risen because last Friday, they were still offering on 9 News and other channels the information for us to go to the public libraries to get N95 face masks, because we needed to have highly efficient masks instead of the surgical blue mask that we were using before. And then on Monday, we hear that the mandates have been eliminated. And one of the things that we need to make sure that people understand is there's no confusion on that. It's just the stage of the curve that we are going through right now. We need to be prepared. We need to mask up wherever we can. That's a good idea, even if it's not mandated. Soon, we will be without masks because they're not going to be needed for a period of time. Soon, we are going to be able to go to restaurants to gather with people. But this is just a transition, a period that we're going to have at the end of this curve of Omicron and the next variant that I hope takes a long time to come, but we don't know.
And Vanessa, I want to go over to you about statistics about where we stand statewide here in Colorado in terms of COVID-19 at this point.
Sure. The numbers are as follows for February 8th, 1,221 new cases reported, 210 new deaths among cases reported, 979 number of persons currently hospitalized with confirmed COVID-19, and 64% of those currently hospitalized are unvaccinated. So what do these numbers show us? It shows us that cases are still high, but not with the record numbers that we had before. We got to the peak of the Omicron surge, and now the curve is declining. So for how many weeks have we noticed this trend? Well, the updated statewide modeling report suggests the current curve has begun to decline and should continue to do so in coming weeks. Though Colorado, as we can see, is still experiencing a high level of the disease transmission in the states. Do we expect it to keep it dropping? Well, being optimistic in an optimistic panorama, we are gaining immunity faster than we are losing it right now, but we could see that change in the coming weeks and months as immunity wanes. And the best things for Coloradans, like we always say, is to ensure the highest level of protection, to stay up to date with their COVID-19 vaccines or get the booster. So we, like Dr. Ricardo Gonzalez Fisher was saying, in English and in Spanish too, we have to be cautious. We could see also a new variant emerge with different characteristics. So that's pretty much in a nutshell what we're seeing it right now.
That's, again, perhaps at least encouraging to hear that we're perhaps coming off of the peak at this point, but we can't let our guard down. Speaking of, well, a way to make sure we don't let our guard down is, of course, vaccination. We spoke about this at length last week, Vanessa, but certainly wanted maybe a data approach to those numbers. Right now, the Hispanic population in Colorado, only about a 38 to 39% vaccination rate. Is that number moving at this point? Are we seeing an increase in vaccination?
Yeah, I mean, we wish obviously that number will be higher, and clinics and efforts like, for example, Servicios de la Raza does with Dr. Ricardo Gonzalez is a great help among the other vaccine clinics across the state, but it's moving up. I would say it's moving up just very slowly. So we can just stick with all the work that we have been doing to reach people where they are. And I would like to share very, very fast about some of the efforts that the Department of Health is doing to reach communities of color and rural communities. And so we're committed to meeting people where they are to offer as much convenience, access, and information as possible to remove any remaining barriers to vaccination and treatment. So we have multiple approaches to do that. So we have a statewide media campaign in Spanish, obviously radio, television, print, digital, and we have put messages at bus stops, billboards, and on buses in targeted neighborhoods. And we have used creative marketing in grocery stores, restaurants, taquerias, and mercados. Also the pop-up clinics and the mobile vaccine clinics have played a very important role to get to the places where people are. And so because we know they are busy, we know they have maybe a morning shift and they can only go in the afternoon or at night, or they have two jobs. So we're trying to get where the communities are. And I appreciate also a lot of what Servicios de la Raza is doing to reach the Hispanic communities.
And speaking of which, Dr. Ricardo, the Servicios de la Raza hosts a weekly vaccine clinic, and I know that's taking place tonight, which is why we're doing it today on a Tuesday. Could you give us some more information about that, please?
Thank you, Chris. Yeah, and thanks, Vanessa, because we are really working to try to be where communities gather or where communities are. And we understand that some people don't have time during the day because they're working. So we open our doors every Tuesday from 4 o'clock to 8 o'clock at night for people who just want to walk in. They don't need an appointment. This is very convenient because you don't have an appointment. You don't have to be in a waiting room. You just come in, fill out your paper, and get your vaccine. And this is the way we've been doing it for a few months now. And we really want to keep on helping people in that way. Some people, if they're listening to us and they were hesitant and they didn't really know that they wanted a vaccine and they think that they want it today, just walk in. We'll be here and we'll be really happy to meet everyone here with no appointment. Just come in and here we are for our communities.
Well, it's a great service and we appreciate both of you, Dr. Ricardo and Vanessa, for being with us here this week. We are going to be kind of switching topics each week to talk about vaccination and COVID-19 in the Hispanic community on a weekly basis. But for now, Vanessa and Ricardo, thank you so much for both of your time here on this Tuesday.
Thank you so much, Chris, for the invitation. Thank you so much, Dr. Gonzalez. And before I leave, I just want to share the website, covid19.colorado.gov. You can find all the information that I shared today here.
Well, there you have it. And of course, the vaccination clinic tonight as well. But thank you again to both of you, and we'll see you again here next week.
Thank you very much.